All right, it looks like my microphone's working and we're going to talk about disabilities. I want to let you know that what I did in this presentation is I went and I found a bunch of information that I thought you would find interesting about disabilities, including learning disabilities, um, that just weren't covered. There's not enough room for the textbook to cover everything, and I just thought you would care about some of these topics that I have. So let me just start by saying that um, I'm sort of organizing this based on the special needs that, the United States has identified as wanting to um, provide special education for. So this list is the number of students who receive special education in each of the categories. I got it from Wikipedia and it's based in 2006. But the idea here is that here's the prevalence, and that like what how often are these disabilities accounted for in special education? And what we see is that learning disabilities, which includes dyslexia, is the largest, the most frequent, followed by speech and language impairment. Other health impairment includes ADHD, which is also quite a hefty percentage, and the intellectually disabled, which also includes Down syndrome, which I'm going to tell you a little more about. Emotional disturbance is also quite common, as is autism. I'm not going to talk about the rest of them, but I will say a few words about traumatic brain injury because it's actually fairly interesting and important. Okay, before we go any further, I want to identify the fact that um, when we talk about children with special needs, um, it's tricky. We don't want to talk about somebody with a disability as being defined by their disability. So that's why it's advised that we talk about the child as having, but not being a condition. So, for example, she has autism, not she is autistic. So she has ADHD, not she is ADHD. Um, and that just helps with, us remembering that everybody's a person and we are all different. And this is just a condition, not the defining factor of a human being. I'm going to start with dyslexia. It's part of the most commonly addressed special need in American education. And there are other forms of learning disabilities, but dyslexia is very well known and common, so I thought I'd go into it in more detail. Dyslexia is caused by a brain abnormality that interferes with the processing sequence of written language. So, with processing the sequence of. So, it's sort of like a sequence processing disorder. You can't see things in the right order, they jump around. Um, it's a it's a abnormality that actually runs in families. And one of the things that people do to address dyslexia is to teach children to recognize the whole word. So instead of like, or in addition to like trying to sound out the word, which can be difficult if the letters are jumping around, then if you start to recognize sort of the shape of the word and you're looking at it more as like a visual rather than a sequence, a complete whole, it can help it can help people with dyslexia read faster. And also another thing that can be done is we can use fonts that work best for dyslexia. So that would be sans serif. This is a sans serif. There's no little doohickeys at the ends. Non-italic and monospaced. That helps with dyslexia. And I wanted to show you what people with dyslexia see. And so here's words, like somebody wrote some script that actually I'm going to open this up, that gives the sense of what somebody with dyslexia might see. And so the way it is like you can read it. It is dyslexia. I mean, you can read the word. A friend who has dyslexia described to me how she experiences reading. She can read, but it takes a lot of concentration, and the letters seem to jump around. I remembered reading about typoglycemia. Wouldn't it be possible to do it? Um, I can't read that word on a website with JavaScript? Sure, it would. And so this is what he did. Um, uh, Pretty interesting, huh? So that gives you an idea of the kind of struggle that somebody with dyslexia has and how they may have to have different learning and strategies in order to perform at the same level as other students. But the truth is, there were lots and lots of successful dyslexic people like Einstein, Steve Jobs. Anyway, let's move on. Another common, very common special need is speech and language processing delays. So, what I have here for you is, how do you recognize speech and language delay in a child? What are some sort of telltale signs? So, if they avoid play that involves talking with others, if they have express aggressive displays of anger instead of using words, like a frustration, like I can't tell you what I think or mean, so I'm going to show you, grabbing or pointing at objects instead of asking for them, difficulty following directions, like step-by-step directions. It may be hard for them to follow because they can't hear it or they're not processing it. Using single word phrases, slurring words or leaving the beginning or end sounds of words off, leaving off the beginning or end sound, using similar but not correct sounds, so saying tooth instead of tooth or parm instead of farm. Now, some of these things you may see in, say, early language development as they're trying to distinguish, but what happens with the developmental delay is that they're actually maybe not actually hearing the difference between a P and an F or a F and a Th. And so that's where that's where the special education comes in, and with help, it can make a big difference for a kid. ADHD is increasingly common. There's a whole controversy about the increasing diagnosis of ADHD. Some people are saying, oh, they're just calling normal childhood a disorder. But there is a continuum, and let's just look at what some of the symptoms of ADHD are. It's persistent difficulty, pardon me, it's persistent difficulty finishing tasks, following instructions, and organizing work. The inability to watch an entire TV program. Frequent interruption of others or excessive talking. A tendency to jump into a task before hearing all the instructions. Difficulty in waiting or remaining seated. Fidgeting or squirming. Let me just open this because there's a... We'll let the ad run. Yuck. Okay, let's go. The beginning of this, we're not going to watch 40 minutes, but look at her go.
9-year-old Samantha is always on the go. She acts like she's driven by a motor. It's easy to see how her behavior can get Sam into trouble at school and make life unbearable at home. Mum Michelle has great difficulty controlling Sam. She's had years of parenting courses, but none have helped, because Sam has a brain disorder that profoundly affects the way she thinks and behaves. Sam was diagnosed with attention deficit hyperactivity disorder, ADHD, last week, and psychiatrist Kevin Appleton is giving her a checkup before prescribing medication.
Anyway.
ADHD affects the parts of Sam's brain that manage and organize her thoughts. Although she has normal intelligence, Sam finds it hard to concentrate on one idea at a time. She's easily distracted, and she acts on impulse. Her brain doesn't seem to tell her to think about the consequences of her behavior.
Okay, it goes on. If you're interested, you can see it. But it sort of gives you this idea of sort of what it must be like for a mom trying to raise a child that just won't stop. And one of the things that uh, is successful in treating ADHD is drugs and behavior therapy. So here, after 14th month treatment period, only the group receiving both medication and therapy outperformed the control group in measures of academic achievement. After 3 years, even that difference disappeared, and there were no significant differences between the four groups in measures of academic achievement, grades, test scores, and social adjustment. They all looked alike. The same was true after 8 years. medication produced no measurable improvement in long-term academic achievement. So one of the things to think about is often drugs are prescribed, and they have definitely there's an immediate result, but it may not relate to a long-term improvement in ADHD. But then if you're just trying to get through the day, some people may reason um, it'll help at least in the short term. But parents are seen to have the greatest influence on the success of ADHD children. It's probably important to notice they probably didn't cause this problem, this brain disorder, like, but there are things that parents can do to help it. Parents have the greatest influence on their young child's behavior. Only therapy that focuses on training parents is recommended for young children with ADHD because young children are not mature enough to change their own behavior without their parents' help. Some therapists may use play therapy or talk therapy to treat young children with ADHD. So, one of the things that is a theme, and you will see me emphasize, is that when working with children, when children have problems, it's really important to bring in the parents and make the parents be part of the solution because children live within the realm of their families. Another common special need that is addressed um, in special education is emotional and behavior problems. And something that I noticed that the book doesn't actually clearly delineate, they reference internalizing and externalizing problems, but most emotional and behavior problems are organized according to these two categories. Whereas internalizing problems are things that you're sort of that are inside, that are based on how you feel. So you may have depression, so anxiety, social withdrawal, you may feel lonely, sad, nervous, irritable, have difficulty concentrating, engaging in negative self-talk. That would be an internalizing problem. An externalizing problem is outwardly apparent. So that's could include aggression like hitting, pushing, biting, or disrupting the class, or acting out in a defiant way, or destroying property, or having there be criminal behavior. So when we talk about emotional behavior problems, you may see people refer to internalizing and externalizing problems, and I want to make sure that you know that these are the category. That's what that means. And when you treat this is just an aside, it doesn't really belong in special education, but like it is important to think about, well, how do you treat children with behavioral problems? And these are just a few peer review papers that I pulled out that I thought were interesting on the topic. So one way to think about it is here's a program that treats the whole family for depression, and it was successful at reducing child's depressive symptoms and the parents. Um, and that symptom reduction was long term. Even after 9 months, there was still a reduction in depressive symptoms. And so this is just like a 15-week treatment for the whole family, but the idea is treating the system instead of just one piece of a system. Another thing to consider is like when you have children with anxiety and you want to consider whether or not to prescribe drugs. What they found was that both behavior therapy and drug therapy reduced anxiety. But the benefit of the behavior therapy, which was cognitive behavioral therapy, is that there were no side effects. And lastly, this isn't so much about treating anxiety, but it's the kind of parental behavior that's related to lower levels of anxiety. And that's when mothers and fathers playfully encouraged anxious children to go beyond their own limits. Then these children exhibited less symptoms of anxiety and were less likely to have an anxiety diagnosis. Another category is intellectual disability. And Down syndrome is one type of intellectual disability. And we probably all know some people with Down syndrome and probably like those people with Down syndrome because at least people with Down syndrome tend to have a reputation for being particularly friendly and nice, although that's not that's just that's just a positive stereotype, I guess. But anyway, so that we know a little bit about it, it's a genetic condition. There's an extra copy of chromosome 21, and it's found in all races. Um, there tend to be distinctive features such as the shape of the eye, like an extra fold. They tend to be smaller in stature. There's a You can see the creased palm, like right here. It's a very pronounced thing, and there tends to be low muscle tone, kind of an awkward gait sometimes. People with Down syndrome are at risk for health conditions like heart, respiratory, and hearing conditions. So you see this little boy, he probably has a hearing aid on because his hearing may not be as good, and that might be related to his syndrome. Life expectancy it's been remarkably increased since 1980. There was a time when um, people with Down syndromes died very young, but with all of the increases in advancements in medicine have greatly benefited. So now the average life expectancy of somebody born with Down syndrome is 60 years instead of 25. There are cognitive deficits and other strengths, and with good education and healthcare, people with Down syndrome can lead fulfilling and productive lives. So yay. Um, Autism is another category, a very, very, very much growing category. Many, many more people are diagnosed with autism. And I wanted to give you a little taste of it. There are different types of autism. We read about autism disorder, autistic disorder, and Asperger's. Asperger's tends to be like more mild and less communicative problems. The problems tend to be nonverbal communication as opposed to verbal communication. Um, but like autism, so spoken language would be more an aspect of autistic disorder, and the social deficits would be found in both. Um, but it's something you may notice in somebody with Asperger's, that there's an emotional processing difference. Like, and it may all come down to emotional processing in the sense that they're just experiencing emotions differently. The value of emotions is different. So what I would love to see is, remember our still face experiment, whether that would even have any impact on a child with autism. The thing though is that um, autism doesn't tend to emerge until age that like 18 months. So a child might start their infant development normally, and then there's like an onset of autism. And that there's often associated with this is sensory processing disorders. So like, oh, I can't stand the tag in the back of my neck, or that's too scratchy, or too loud, too loud, too loud. So there can be, I mean, not only is emotion processing possibly different, but also sensory processing seems to be quite different in many people with autism. And then there are repetitive behaviors which might be associated with sort of soothing. So like I'm rocking now, but like it could be like a rocking or like a hand flapping. Wait, there's like a hand flapping is a common thing that you would find in people with autism. Um, yeah, and for people with autism, routines and predictability is super important. And transitioning from one thing to the next can be very difficult. Somebody with autism is probably going to be a very literal, concrete thinker. And I read in this book a fascinating anecdote about how difficult it is for people with autism to lie. It's just an anecdote, but there was a special education teacher, and she had one group of unruly boys and one group of autistic boys. And she went to her unruly boys and she said, "Let's talk about lying." And the unruly boys, they were like, okay, yeah, got into it. They started talking about when you would lie and when you wouldn't lie and why you would lie. And they just had a great time. And then she went to her autistic classroom, her classroom of boys with autism. And she said, okay, let's talk about lying. And, and she says, was there ever a time that you lied and like nobody would say anything and everybody was uncomfortable? And finally, one boy said, Yes, and he burst out crying. He was so upset by the idea that he lied. Like they just had no, this class had no ability to even process the idea of lying. And I just thought that was a fascinating difference that may not show up in the big studies of autism, but like in this book, as she was capturing the differences, I thought it was fascinating. And one thing to remember about autism is that parents don't cause autism, and neither do vaccines. One, I'm going to just show you this. Temple Grandin is one of the most amazing women. I'm really tempted to play you this, but it's just, I am so inspired by Temple Grandin. She's a woman who was born with autism, and it was very severe when she was young. And now she's an activist to, and writes books and explains what it's like to live with autism. And her career is in animal care. So she advocates for humane treatment of animals, even if they're on their way to the slaughterhouse. She designed a an incredibly complex and thoughtful way to prevent the animals who are just about to die from suffering any more than they have to. So she is fascinating, and I encourage you to check out this video and any video on Temple Grandin. There's another one I added, which is her giving a talk. She was receiving an award, and this is her. You can sort of see her talking. She's kind of funny looking, and she has some of like what we might consider strange mannerisms, but what's beautiful about it is she makes those strange mannerisms, she just wears them like this is who I am, this is what I do, this is what's great about me, this is what's different about me. But she does it, it's just, she's just such an interesting person. Maybe we'll come back and visit her later when we talk about adult development. It's also important to note that early intervention in autism can make a huge difference. In some, like essentially, it improves communication. It can even change the pattern of brain processing if the autistic tendencies are found early, and they are involved in the right kind of intervention. It can even sometimes cure the disorder. That person may always have similar tendencies and kind of be a little bit like Temple Grandin, but the but the symptoms of not having speech or having to rock, like there's just whole those symptoms are they don't even necessarily need to appear if there's early intervention. Here is a another video, and these parents have a great attitude about his child with autism, and I think I'm going to make you uh, watch it, but not now, because there's so much about these parents and how they're raising this boy that is inspiring. Also, how do you recognize vision problems in a child? That's another thing that might be an issue in special education. But often vision problems can be just addressed with the right kind of glasses, right? But you want to be looking for squinting, tilting the head, covering one eye, sitting too close to the TV or holding the materials too close, or excessive eye rubbing, or headaches, pain, or difficulty concentrating on schoolwork. I remember when I got my sunglasses, he was in the second grade. His second grade teacher noticed it. I never did. And she said, he might need glasses. And they had him tested, and he did. And he was like, he was like, he was like, wow, trees have leaves. Like he couldn't, he'd never seen leaves on trees unless he was up close. It was fascinating. The last thing that I want to talk about is traumatic brain injury. It's like a big deal. We talked a little bit about how, the biggest risk to children's lives are accidents. The book talked about that, but also just this is, the accidents. Look at this number. More than 500,000 children go to the emergency room for brain injuries, and then 62,000 are hospitalized. And I just want to give you a sense of the big deal about the problem that a brain injury is. You could lose speech, vision, hearing, headaches, coordination, spastic muscles, paralysis, seizures, lose your balance, extreme fatigue, memory deficits, concentration problems, slow thinking, limited attention, impaired perception, mood swings, denial, self-centeredness, lowered self-esteem. It can actually change your personality. I deleted the word sexual dysfunction because it's not really appropriate for children, but like difficulty controlling emotions. Like these are major personality changes that are happening. So if you have a child and they're in the middle of trying to discover who they are and developing new skills and discovering new abilities is so important to them getting a sense of who they are. The last thing that you want is for them to like fall off their bike, hit their head, and get a brain injury. So that's my pitch for that. And lastly, here's a little one of those little things that you can find on Pinterest. Every child is gifted, they just unwrap their packages at different times. And that is our discussion of disability.